Hi, it's Romney Humphries and Emily Bentley again from Vanderbilt University Medical Center. We're here chatting about non-fermenters and susceptibility testing. And so Emily has another question about susceptibility testing.
For CF patients, cystic fibrosis, why are non-fermenters, non Enterobacterales, validated for automated AST but not Pseudomonas?
Yeah, that's a good question. Yeah, because we have to use disk diffusion for them, right?
Right.
Yeah. So I did some digging in the literature because we've all heard this, right? You can't do disk diffusion for your CF patient Pseudomonas. And so this all started back in the 1990s, where there was a series of publications that were put together by Ron Jones's group, and they looked at the optimal method for susceptibility testing of these CF strains, and especially these mucoid ones. And you guys have probably seen it. Sometimes they don't grow very well, and they take like 48 hours, or they're like extra goopy and really hard to get a good inoculum with. So the first thing they did is they said that broth microdilution by the reference method seems to work pretty good, and they used agar dilution as the comparator. So then they said, do DISC and E-test work? And then in this next paper here, they said, yep, those work. And so that was good news. And then they said, okay, great. What about the automated systems? And that's where things kind of fell apart. And so what they showed was that the reference methods were unacceptably low for all agents on both commercial systems, with a high rate of very major false susceptible errors. The mucoid strains were worse, but both the mucoid and non-mucoid were problematic. And so the challenges here are that these mucoid isolates are hard to get a really good inoculum when you make your 0.5 McFarlane, right? Because there's so much goo that's not bug, it's like extracellular alginate and stuff like that. So you might think you have a lot of bug there, but you have just a little. And then the other thing is a lot of them take at least 48 hours to get like a good growth, and those time out on the automated systems. And this is just some examples of the error rates, but like, up to 31% for piperacillin, 20% for aztreonam, pretty bad for ceftaz. So it's just not like very tolerable for these bugs. That's why. Okay. The other non-fermenters, they seem to grow a little bit better. So, yeah.